જય જિનેન્દ્ર બધાને સૌને અને વેલકમ ટુ શ્રી નવયુગ જૈન પ્રગતિ મંડલ્સ યોર હેલ્થ your well-being sessions. Apra બધા sessions, they're all recorded live on YouTube. So your presence is consent to share online. All the information given here in this session and any future sessions we may hold is general advice, and all participants should consult their own GP or other professionals in accordance with your personal situation. The organizers take no responsibility for consequences arising from your failure to seek independent advice for your situation. So please bear this in mind.
Mr. Gurudatt Sisodia, a consultant orthopedic surgeon છે. એમની સ્પેશિયલાઇઝેશન છે ની એન્ડ હિપ સર્જરીમાં, ઘૂંટણની અને હિપની સર્જરીમાં એટ મેન્ચેસ્ટર યુનિવર્સિટી NHS ફાઉન્ડેશન ટ્રસ્ટ. એમની એક્સપર્ટીઝ છે રિકન્સ્ટ્રક્ટિવ સર્જરી અને રિપેર સર્જરી ફોર સ્પોર્ટ્સ ની ઇન્જરીઝ અને ટ્રીટમેન્ટ ઓફ આર્થરાઇટિસ, ઘૂંટણની આર્થરાઇટિસ, હિપની આર્થરાઇટિસ અને જનરલ આપણે જે હાડકાના કંઈ ટ્રોમા થાય તો એના અંદર એ એઝ અ ઓનરરી સિનિયર લેક્ચરર પણ તરીકે યુનિવર્સિટી ઓફ મેન્ચેસ્ટરમાં મેડિકલ સ્ટુડન્ટ્સને ભણાવે છે. અને આવા લેક્ચર્સ એમને પહેલાં પણ થોડા કર્યા છે આપણા કમ્યુનિટીમાં. એ બધાને એમની જાણકારી એટલે એમની એક્સપર્ટીઝ બધાને શેર કરે છે. સો થેન્ક યુ ગુરુદત્તભાઈ, એન્ડ ઓવર ટુ યુ.
જય જિનેન્દ્ર બધાને અને નમસ્તે. આપ સર્વેને ટાઈમ લઈને આવ્યા તો એના માટે ઘણો આભાર. આજે હું ની અને હિપ વિશે વાત કરીશ, સ્પેસિફિકલી ઓસ્ટિયોઆર્થ્રાઇટિસ વિશે અને એને કેવી રીતે કાળજી રાખવી. તો પહેલા આપણે જોઈએ કે આર્થ્રાઇટિસનો મતલબ શું છે. આર્થ્રાઇટિસ એકચ્યુઅલી મતલબ છે સાંધોનો સોજન. And it's a really common condition, most common cause of disability in the UK, and more than 10 million people are affected. And our main symptoms are sojan, dukhao, and stiffness. And it gamite body no joint ma asar thai, and usually heart, pug, guntan, hip, and kamar ma vadar hoy છે. Juda juda jatna arthritis hoy શકે. And osteoarthritis is the most common. Emo sandamo gasai jai. And inflammatory arthritis is another type. Jemo sojan vadar hoy. Which crystal arthropathy is another type. That like gout, athwa to pseudo gout. Which post-traumatic arthritis no matlab છે કે accident પછી athwa to injury પછી arthritis થઈ શકે. અને સેપ્ટિક આર્થરાઇટિસ એટલે જ્યારે સાંધામાં ઇન્ફેક્શન થાય પછી આર્થરાઇટિસ થાય. તો ઇન્ફ્લામેટરી આર્થરાઇટિસ દાખલા તરીકે રુમેટોઇડ આર્થરાઇટિસ અથવા તો સોરાઇટિક આર્થરાઇટિસ હોય છે. અને આ આર્થરાઇટિસમાં બોડીનો ઇમ્યુન સિસ્ટમ એને જાતને એટેક કરે અને ખાસું જોઈન્ટ ડિસ્ટ્રક્શન અને ડિફોર્મિટી પણ કરી શકે. આ ફોટોઝમાં તમે જોઈ શકો છો કે આ લેડીઝના હાથમાં કેટલા ડિફોર્મિટી છે અને એક્સરેઝમાં ઇફ યુ સી ધ જોઈન્ટ્સ એમાં કેટલું ડિસ્ટ્રક્શન થઈ ગયું છે. પણ સારા સમાચાર એ છે કે આના માટે ખાસ દવાઓ છે હવે that can prevent severe problems. તો જો જલ્દી ખબર પડે તો ક્રિસ્ટલ આર્થરાઇટિસ આ એક ટાઈપનો આર્થરાઇટિસ છે જેમાં સાંધામાં ક્રિસ્ટલ્સ જમા થાય. અને આ પિક્ચરમાં જે જોઈ શકો છો તમે, these are crystals that you can see. And this is a really very painful condition. અને આપ જોઈ શકો છો કે આ ઘૂંટણમાં કેટલો સોજન આવેલો છે અને કેટલું દુખતું હશે. Usually it affects the knee athwa to pagno angutho, but it can also affect the hands. And over time, you can get this calcium being deposited in the joints, and that can be painful and also destroy the joint. And our main symptoms are sojan, redness, and a dukhao. And risk factors are alcohol vadar levanu, meat khavanu, fatty foods levanu, obesity. So the main treatment for it, or prevention, is to bring about lifestyle changes like reducing or stopping alcohol, meat, fatty foods, drinking more water, and fruit juices levati in a prevention થઈ શકે. Osteoarthritis વધારે common છે અને એમાં સાંધાના જે cartilage હોય છે એમાં ઘસારો થાય અને એ ધીમે ધીમે વધી જાય. And also there's inflammation as well as this wear and tear. And it's the most common type of arthritis. અહીંયા જોઈ શકો છો કે it's a really common disability. More than 8 million people are affected in the UK from osteoarthritis. Umar 75 થી ઉપરના લોકોમાં વધારે હોય છે and it's more common in women. And the knee is the most commonly affected joint. You can see on this graph here. And our map ni andar you can see ke jema dark colors che, like London, Birmingham, Northwest and Scotland, there arthritis vada prevalent che. So to understand osteoarthritis better, it's first important to understand what the normal joint looks like. So with the hip, at the top of the thigh bone, you have the ball. And the ball is covered in this nice cartilage, you can see here. And that forms a joint with this cup inside the pelvis. And together they form a nice, smooth, shining joint. Same hoiche, the cartilage covers the ends of the bones and also the back of the kneecap. Ane ligaments pan che guntan ni andar, aye dekhai che, ane aju baju bhi hoiche, and these help to stabilize the knee. So it works like a complex hinge. So here's a picture of the knee. ane apne nazik thi જોઈએ તો તમે જોઈ શકો છો કે this is a picture taken, a photograph taken during keyhole surgery. એમાં જે બંને બાજુ cartilage છે અને એની વચ્ચે છે meniscus, and the meniscus is like a cushion of the knee, and that helps to protect the cartilage from damage. Microscope થી જોઈએ cartilage ને તો આવી રીતે દેખાય. And it's a really complicated structure, and it helps to protect not only the bone underneath, but also the inside of the cartilage. And if damage thai, to permanent damage રહેશે કારણ કે એમાં blood supply નથી. એટલે cartilage નો ધ્યાન રાખવો બહુ જરૂરી છે. So in osteoarthritis, this is what happens. Dhime dhime you get cartilage ઘસાઈ જાય and it cracks spontaneously. And you can see in these photographs, the normal cartilage, dhime dhime ghase jai, and it gets more and more worse with time. And you can see on this photograph, it's very severe. હવે osteoarthritis na કારણ શું છે એ આપણે જોઈએ. મોટી ઉંમરના અને લેડીઝમાં વધારે થાય છે. તમારું વજન વધારે હોય તો પણ થાય. સાંધામાં વાગ્યું હોય તો પણ થાય, અને તમારા ફેમિલી હિસ્ટ્રી હોય તો પણ તમારા ચાન્સીસ વધારે હોય છે. અથવા તો તમે હાર્ડ યા હેવી કામ કરતા હોય over many years તો પણ થઈ શકે. Osteoarthritisના ખાસ symptoms છે દુખાવો, and our dukhao can be very severe, so severe that it's affected by all the activities that you do. Chalawama taklif pade. And even some people have pain at rest, so sitting down and at night time in bed, it can keep them awake. When the arthritis affects the knees, the typical symptoms are pain, which is made worse by climbing stairs, crouching, kneeling, and with the hip, usually જ્યારે તમે મોજા અને shoes પહેરતા હોય અથવા તો પગના નખ કાપતા હોય ત્યારે વધારે દુખાવો હોય. And sometimes getting in and out of a car can be very painful. Stiffness is very common. Sojan is common. And a sandama creaking awaj pan thai shake. And gradually halan chalan ochu thai jai as well. Osteoarthritis ne કેવી રીતે diagnose થાય? Well, usually it's X-rays. X-rays what you cover, but you can see on this X-ray in a normal knee, you have the bones, and if you have a space, the joint space. Actually, this is not space. There's cartilage, but you can't see the cartilage on the X-ray. This patient has severe osteoarthritis. No joint space has gone, and the cartilage is completely damaged. Sometimes we can use MRI scans to help diagnosis, ultrasound scan, and sometimes we do an injection as a test, not only as a treatment. Hip arthritis no X-ray here. And you can see the ball and socket joint. And this is a relatively normal hip because the space is maintained. You can see the space between the ball and the socket. And now Biji Baju in the same patient, the space has gone and there is severe osteoarthritis. Cartilage badu gase gelu che. And that's obviously will cause severe pain for the patient. Osteoarthritis patients માટે આ pandemic થી ઘણું ખરાબ થયું છે કારણ કે એક તો exercise ઓછી થાય અને વજન વધે. પછી ઘણા operations like hip and knee replacements બંધ રહ્યા છે COVID કારણથી. પછી physiotherapy and injections both times સુધી બંધ રહ્યા છે. So all this has had a major impact on arthritis patients over the last 18 months. The treatment depends on different factors like severity of the symptoms, severity of the disease, the effect on your daily life, tamara functional demands suche. For example, Dr. Tarike, the patient he lives in a care home, in a kali bed, chair, ni jaruche chalwani. He doesn't go outside, so his functional demands are very low. So for him, an operation may not be needed. But for this man, he's younger, he wants to be active, he's working, and he wants to play leisure activities. So for him, we may have to do something like an operation. Umar sathe biji koi bimari hoy to pan it can affect which treatment is appropriate for you. Or if you have worsening deformity like in this picture, this lady has a bad knee deformity. So sometimes we do an operation or we recommend operations before the case becomes too complicated. If your symptoms are mild or if you have low functional demand, or if you have a really high risk for surgery, then we recommend non-operative management. So treatment without surgery. I think exercise and physiotherapy both important છે આના માટે. એક તો તમારા muscle strength માટે કારણ કે જો તમારા muscles weak હોય તો જલ્દી થાકી જવાય અને વધારે દુખાવો થઈ શકે. બીજું કારણ એ છે કે વધારે flexible રહી શકો છો તમારી knee and hip માં. And there are really important and proven exercise programs like Escape Pain, which your GPs can actually refer you to, and they're run by often physiotherapists, and they run as a group where you can improve your pain and function and mobility. So really worth asking your GP about these kind of things. Biju tamara potana mate lifestyle changes lavi શકો છો. દાખલા તરીકે વજન તમારું વધારે હોય તો કંટ્રોલમાં રાખવું જોઈએ કારણ કે with every step you take 5 times your body weight goes through each knee. પછી આખો દિવસ સોફામાં બેસીને ટીવી ના જોવાનું કારણ કે your exercises will be suffering. પછી walking કરતા હોય તો you can use these walking sticks. And exercise જે recommended છે is things like swimming and cycling. Jo કરી શકાય તો કારણ કે these are less impactful for the knees and the hips if you have damage. બીજું option એ છે કે તમે દવાઓ લઈ શકો છો. Paracetamol, codeine, tramadol, પછી anti-inflammatories like ibuprofen, જે તમે tablet અથવા cream forms વાપરી શકો છો. અને એક બીજું જાતનું cream પણ છે મરચામાંથી બનાવેલું છે. This is also recommended by NICE. If you haven't tried it, then it's worth giving that a go. Orthotics is things like a sleeve or a brace or a splint that you can wear on your knee. And that's helpful if you have a slight deformity, or if you have some unsteadiness in your joint, or if you want to do sports, then these things can help. But amuk loko mate glucosamine and chondroitin are helpful. And our biji jatna tablets છે જેમાંથી cartilage માટે helpful રહી શકે. હવે અમે તમને કેવી રીતે મદદ કરી શકીએ? Injections જુદી જુદી જાતના હોય છે અને available હોય છે. એક છે steroid injections જેનાથી most patients ને લગભગ 3 થી 4 મહિના સુધી આરામ મળે છે અને એ તમારા GP અથવા તો હોસ્પિટલમાં મળી શકાય. બીજું છે hyaluronic acid, and this is an injection which is designed for cartilage. કારણ કે cartilage ની અંદર hyaluronic acid normally હોય છે. So this can help with that, support the cartilage, but also with lubrication. પણ આ ખાલી privately જ મળી શકે છે. Another option is a PRP injection or platelet-rich plasma. And for the last few years, there's some good emerging evidence for this. And this injection involves taking a blood sample from you, spinning it in a centrifuge, and taking a portion of the sample, which is called the plasma. And the plasma contains these cells called platelets, which when we inject them into any site where there is damage, they can help with healing. So it can actually help the cartilage, usually from causing further damage, but also it has a mainly anti-inflammatory effect. So this is something that you may have access to depending on where you live. Next option is surgery, and Emma, keyhole surgery kari shakai, but it depends on the type of arthritis and what other problems you have. So one reason to have keyhole surgery is if je tamaru cushion je hoy meniscus mein je batayu tu earlier on, if there's a tear, then it's worth having keyhole surgery if you're having symptoms. Atwa tamara guntan ma kai floating thatu hoy, like in this picture, then keyhole surgery can be successful. But bada jatna arthritis mate yogya nathi. So it's important to be very selective. And this is how we perform the surgery. So we use a small camera and instruments through 2 small holes in the knee, and we can do these operations. Usually it takes less than half an hour, and you can walk on it very, very quickly straight away. It's a day case procedure, but it's very dependent on the type of problem you have. Next option is joint replacement, and this is for severe disease and severe symptoms. I ખૂબ successful operations છે. UK માં લગભગ 160,000 knee and hip operations દર વર્ષે થાય છે. Average patient 70 વર્ષથી મોટા ઉંમરના હોય છે. And the vast majority of knee and hip replacements last over 20 years, so very successful. On the left-hand side, these are examples of partial knee replacement. And our patient ne partially karayi છે કારણ કે arthritis ઘૂંટણના અડધા ભાગમાં જ છે. અહીંયા દેખાય છે અહીંયા. આ બાજુ નથી. So they had a partial knee replacement. On our right-hand side of it, you can see a total knee replacement. And this is an X-ray of that, where the disease affected the whole knee. આ X-ray માં એક બાજુ hip replacement કરાયું છે on this side. And here you can see the different types of hip replacement components. Amuk stainless steel na banela hoy છે, amuk titanium na hoy છે, amuk plastic na, amuk ceramic na hoy છે. So summary ma knee and hip arthritis બહુ જ common conditions છે અને amuk patients ને બહુ જ કમજોર બનાવે છે. Osteoarthritis na જુદા જુદા કારણ બી હોઈ શકે છે, obesity અથવા તો previous injury, or inflammatory conditions. And our pandemic and lockdowns na lidhe amuk patients ne symptoms khubaj vadi gaya chhe. The treatment of osteoarthritis in particular should not be seen as just one option, but actually multiple options, including exercise, weight loss, medication, injections, and surgery is really only for those people and patients with very severe symptoms.
Does weather have any impact on arthritis, or does cold weather cause arthritis?
I don't think it causes arthritis, but we have a lot of patients that complain about the same thing. So they find that after it gets colder or wetter, then their symptoms get much worse. So in the winter, they get worse. If they go on holiday to summer destinations, their symptoms are better.
Can I prevent arthritis? કે હું arthritis avoid કરી શકું છું કે મને arthritis થાય જ નહીં આખા લાઈફમાં?
Prevention though is difficult, but you can avoid injuries. So sports karta hoy to then it's important to warm up, do exercises first. But impactful activities, so amuk janne running no more shock hoy che. So you have to bear in mind that if you're running marathons for many years, then arthritis no vadar chances hoy che karan ka cartilage dhime dhime gase jai sake. So it's not always the case, but the chances become higher. But if you're in manual work karta hoy like a builder or something for many years, then there's a chance you will have osteoarthritis. So sometimes it's related to your activities and your work, and your leisure activities. So prevention in that sense is difficult. But if you are careful in terms of sports and injuries and warm up and build your muscle strength, then yes, you can reduce your chances.
Do we need an X-ray always to confirm arthritis?
The symptoms of your experience toy questions which come out that we can usually predict the amount of osteoarthritis hoy chicken. But yes, to make the diagnosis and confirm what's going on, then yes, you should have an X-ray.
Next question, Chair. If I have osteoarthritis, do I always have to see a surgeon?
No. So as I showed I tried to show on the presentation, osteoarthritis is like a spectrum. So it starts off mild and then it becomes severe. So obviously when it's mild, or if you don't have the high functional demands, then you don't necessarily need to see a surgeon, because surgery is really reserved for severe cases. But in the first instance, you should be seeing your GP, or your GP sometimes may have a referral system to physiotherapists who can assess you. But it's important to try all those other strategies. So pain relief, anti-inflammatories, exercise, weight loss, all those things your surgeon would say anyway if you haven't tried them. So it's important to do all those things first before thinking, right, you need to see a surgeon straight away. But there are one or two conditions which your GP would be aware of, where we'd say, yes, we'll get you to a surgeon quicker. But it depends very much on symptoms.
Next question is, if I'm having a total knee replacement or a total hip replacement, how long will it take for me to recover completely?
Usually, hospital most patients stay lagbhag 2-3-4 divas mate. You're usually working on it by the first day or the next day. Pehla ek kabe lakdi vaparvani hoche, or either that or a Zimmer frame. Usually we see the patient 6 weeks after the operation in clinic, and by that time most patients are using just one stick instead of 2 sticks. Some patients are using no sticks. So usually 6 weeks, 7 weeks is like a turning point. Patients notice a big difference, but some patients can have pain for 3 or 4 months, which gradually improves. And swelling can be there for anything up to 8 or 9 months.
Alternative therapies no su role che arthritis ma?
Actually, strong evidence nathi. But we see patients who take it, and emna mate they feel that it really helps them. So, home remedies, haldi or ice, ice packs certainly help. Haldi, creams, these things can help. Homeopathy, yes, again, not strong evidence, but most of these things don't have side effects. And just side effects now, though it's worth potentially trying, but there's no strong evidence behind most of those options. Some GPs can refer you to for acupuncture as well, but again, there is not strong evidence behind these things yet.
What are the side effects of the corticosteroid injections and a benefits uche levana?
Corticosteroids અથવા તો just steroids, khasa varshoti they've been used, so they're quite safe. But amuk loko very rarely side effects we call it a flare reaction. So jarak vadar sojan thai sake, usually within a few days, thoda divas pachi. But this is very rare. In maybe 10 years, I might see 1 or 2 patients that have this reaction. So it's really rare. Usually there's no reaction. Usually pelato local anesthetic no effect is very quick. So, within minutes, you feel a big difference with improved pain. And then steroid effect, lagbag 3-4 divas pachi chalu thai. And for most people with arthritis, they get maybe 3 to 4 months improvement. Some people, it's only 2 or 3 weeks. And jo tamara minimum 6 weeks ni benefit na hoy, then I would say it's not worth having another injection. But if you are getting minimum 6 weeks of improvement, then we say, it's okay to have 3 or 4 injections per year.
Okay, so there's a question on the chat, Dr. Gurudatt, that I have been diagnosed with osteoarthritis in upper back. It is painful. Now, what are the reasons for this?
If they mean upper back in the spine, then, having pain in the spine and in the back is a different condition because there are so many different causes of it. And sometimes you never actually find a cause for back pain. It's one of those very common conditions, but there isn't always a cause. Osteoarthritis for your back, then the same kind of medications can help. So paracetamol, anti-inflammatories, codeine, but exercise is really important. So Suraj Bhai is a physiotherapist and he has expertise in spinal patients as well. So I'm sure he'll have some comment on that. But really important to keep your spine flexible with movements which you don't normally do in daily activities. So you actually have to take part in specific exercises to stretch your spine. But losing weight as well. Amuk loko, they've gained weight, and when they gain weight, the spine bends forward. Amuk loko khasa time to the computer for on a desk. And again, that posture can make things worse in their spine. So it's again, a number of things to look at in terms of exercise, weight loss, posture. If you are sitting at a desk for many hours a day, then make sure every 20 minutes they ubatain and exercise karo. So it's really, really important to keep mobile and flexible.
Amara local area where I work now, Brent ma. They've come up with a very strict rule. Okay? If you are obese or overweight category, तो 10% वजन अगर तमे कम नहीं करो तो तमने replacement surgery नहीं मिले. So firstly, what are your views? What do you think? क्या वो करवू जोइए? And if it is there, then what are the advantages of this?
Yeah, I think it's a difficult problem because Adeshma, it's following like America. Adeshma, obesity has become really prevalent. So not only in the native community, but even Apra Lokama, it's much higher here than it is in India. So it's something that we have to look at. And obviously, there's a really important link. So obesity and musculoskeletal problems. So obviously, if you have arthritis hoy, so then you're usually less active and then your arthritis gets worse. So it's a vicious cycle. So we definitely understand as surgeons why તમારું વજન વધી ગયું છે when you have knee or hip arthritis. But there are definitely exercises that you should be doing, like cycling, like exercise bike. I always tell patients, invest in an exercise bike at home. So you can just sit there, do the exercises. તમારું bodyનું આખું વજન does not go through the exercise bike or through your knees when you're using it. The exercise is easier than walking or running and things like that. But in terms of knee and hip replacement, the implants, especially knee replacement, is not designed for such a high amount of weight. You know, the knee replacements, we say, 96% will last for maybe 15 years at least. Most will last more than 20 years. But that's if you're an average patient, relatively slim in their 70s. But now we're seeing patients who are getting obese, who are coming to us in younger age, and that knee replacement, it won't last for that length of time. So, we really recommend weight loss first. And in terms of a limit as to how much weight you should be, every region is a bit different, but usually we say, a BMI, which is a measure of your weight and your height. If 40 thi upar hoy, then you shouldn't be having knee replacement or hip replacement. Usually, some people even say 35 thi upar hoy, then they won't do it. But if we see evidence ke tame tamara jatne weight matic control ma lavi shako cho, if you're losing weight and you're improving, then we might say yes, okay, we can do this for you. And jo tamara weight really high obesity, then you should be seeing your GP about different options like gastric band surgery, some other kind of weight loss surgery. And this is an option, but that's for extreme cases where you've tried everything else and those things have failed.
There is a question about surgery therapy. Can I ever sit below my knee level?
It's definitely possible. But it depends on the amount of movement you have before. Just the operation pehla kitlu flexibility hoy, that determines how much you have afterwards as well. So that was the other important reason why I was saying flexibility maintained karva mate, it's really crucial, because if you have a very stiff knee before your knee replacement, then afterwards we can improve it a little bit for you, but we will not have as much movement as we'd like. So in answer to the question, yes, you can kneel down on your knees as well after the operation. But how much bend you have depends on how much movement you had before.
One interesting question. I am 65-year-old. Can I run on the treadmill? Or can I do impact activities?
So, jo tamare osteoarthritis na hoy and the symptoms na hoy, so yes, no problems. But jo tamare symptoms hoy and osteoarthritis hoy, so running regularly is not good for your knees. So sometimes that message gets mixed up when you hear some people say, "Oh, you should not run," generally. That's not true. Running is generally good because it's good for your heart, good for your general body health. But if you have damage already to the joints, then impactful activities like running will make it worse over time.
Someone's asked if I go for replacement, મારે અગર મારા ડોક્ટરે મને કીધું છે કે એના પછી હું MRI નહીં કરાવી શકું. Is that true?
MRI કરી શકાય, પણ એનો યુઝફુલનેસ ઓછું હોય છે, કારણ કે એ મેથડ અને જે knee replacement method જે છે, it creates extra signal in the imaging. So image quality જરાક ઓછી થઈ જાય. એટલે બસ એ કારણથી they might have said કે MRI નહીં કરી શકાય. Technically you can have an MRI, but it's less useful.
Should we stop sitting on the floor once we are diagnosed with arthritis? હું નીચે બેસવાનું બંધ કરી દઉં કેમ કે મને આર્થરાઇટિસ થઈ ગયું છે?
નહીં, નીચે બેસવાથી તમારા hips અને knees માં વધારે flexibility રહેશે. એટલે I think જો તમે કરી શકો તો you should carry on trying to sit down. Yeah.
If I have constant pain, heel pain, Is that sign of future arthritis or knee problem?
It could be. So sometimes jare severe osteoarthritis hoy, so that can cause constant knee pain. Our patients hoy che clinic ma to khasa eva hoy che ke jema severe pain hoy che constantly hoy che ratri hoy che in bed, it keeps them awake. So bani shake it might be osteoarthritis, but it depends when it started, injury thati tamane. So it just depends. So if they have constant severe pain, so GP should be referring them to either physiotherapy or orthopedics if they haven't tried any treatments. Yeah.
Okay. They have just said that constant heel pain, not knee pain.
Heel pain, right? Heel pain. Heel there's a few different conditions. Bani sake ek to plantar fasciitis kehvai. Jema heel ni andar and pag ni andar there can be some degenerative change and ema dukhao khaso hoy che, and it can be made worse. Savari vadar hoy che usually. And again, enemate usually GP should be referring to physiotherapy to start with. Enemate night splints perishakai. So in bed you can wear the splints to make your foot kind of upright like this. Pachi bija problems bi hoi sake heel ni andar arthritis hoi sake, pachi sometimes nerve pain bi hoi sake. So if you have a nerve entrapment, spine ni andar, so that can give you pain in your heel or your leg or your foot. So a few different conditions.
Say, for example, frozen shoulder. Symptoms are very similar to arthritis to start with. But once it is confirmed that it's a frozen shoulder, how long does it last, and what other treatments would you suggest?
Frozen shoulder the shoulder is like a ball and socket joint as well. The capsule bulge inflammation and it becomes very, very stiff and very, very painful. And usually it's very quick onset. Sometimes injury pachi atwa accident pachi thai atwa to if you have diabetes, that's a higher risk of getting frozen shoulder. But in a treatment mate, there's a few options as well. Sometimes steroid injections, but there's a operation as well. So the surgeons can manipulate the shoulder. Pehla tumne behosh kar de anesthetic thi, but they move the shoulder up and down, and they capsule that gets torn apart. It sounds really painful, but that's one of the treatments. But another more recent treatment is where they inject high pressure fluid into the shoulder, saline, just panigum, and they can inject that into the shoulder joint, very high pressure, and that's been shown to help as well. So there's a few options, and this more recent option is less traumatic, so less painful and low risk, and I think it has a relatively high success rate as well. It's not my specialty, shoulder surgery, but I'm aware of that.
But does this only defer the pain or actually treats it? That most recent option that you gave.
Yeah, it can treat it, but sometimes it might need one or two of these treatments to get on top of it. But untreated shoulder, frozen shoulder can take between 18 months and 2 years to resolve. It goes through like a cycle of activity where it's very painful, then inflammation, then it starts to calm down. But it's a long process.
Crystal form thai, and then what is that crystallization? And
so there's two main conditions. Ek to gout and ek pseudo gout. And a gout more uric acid crystals form actually joint ni andar. And obviously the crystals you can see a picture to Emma, they're needle-like crystals. That's extremely painful, and usually it happens ekdam જ થાય છે. Like within a few hours you can develop this. So it's rare. Usually there's a family history હોય છે, so usually parents, brothers and sisters may have history of it. Dehydration is one of the main causes. I mean, dehydrated હોય તો alcohol લેતા હોય બધા તો પણ થઈ શકે, meat બધા या fatty foods લેતા હોય તો પણ થઈ શકે. Usually it was called a rich man's disease. પહેલા વર્ષો પહેલા when people used to drink and eat meat when they were really rich, excessively, so they used to have a high incidence of gout. And a pseudo gout similar condition છે પણ જુદી જાતના crystals હોય છે. તો કોકવાર એટલું severe pain હોય છે કે લોકોને હોસ્પિટલ્સમાં આવવું પડે છે, and they come to A&E and then they get referred to us. We see them, admit in hospital. We usually give them strong pain relief, and it's a relatively rare condition, very severe pain, and it can last 2-4 દિવસ માટે it can go on.
એટલે mainly dehydration, એટલે પાણી પીતા રહો તો જરા સારું પડે.
Yeah, dehydration અથવા તો it's garam વાતાવરણ હોય, if you've not been drinking well, exercise વધારે કરી હોય and you've not been hydrated, અથવા તો you have those other risk factors, dietary risk factors, alcohol, obesity.
Mid-60s in the gym, if you have an option of going incline, high incline, brisk walking, level running or biking, which is better? No issues at the moment. Which is better to strengthen yourself and avoid it in the 70s?
So if you have no problems with your joints as such, no pain, no diagnosis or anything, then I would do all three, because they're all different activities. Judi jatna exercises, so they'll activate different muscles. But if you were to choose one of them, then I'd probably say cycling is the best, because it keeps your knees and your hips moving. It builds the muscles around your thigh, your calves, and it's less impactful on your knees and your joints generally. So that's probably the best one. But if you, generally speaking, it's good to do all of them. But if you have damage already in the knee or the joints, then the running and the high incline may make your symptoms worse, whereas the cycling is likely to be easier for you.
Dr. Sisodia, what a brilliant session. તમે એટલી effort લીધી છે. I have to say that you mentioned at the start about taking the efforts for Gujarati also. So that's really brilliant. And I think my language and the whole presentation was, in very simple terms and terminology. So I'm sure everybody has understood. Non-medical background માંથી પણ બધા જે છે આપણા જે audience, elderly people, I think everybody has gained a lot